Welcome to our chemotherapy education session for patients and families at the Walker Family Cancer Center. In this presentation, you will learn general information about chemotherapy, where to find helpful information about possible side effects related to chemotherapy, and how to keep yourselves and your loved ones safe during treatment. Your cancer care team has provided you with a patient education binder. It is important that you bring your binder with you to each visit and ask your cancer care team to review information whenever you need to. Your personal treatment plan can be found in Section 5 of the binder. It will be reviewed with you at your clinic appointment if that hasn't been done already. The binder also has other information that may be helpful while you are on treatment. Now let's review some of the main sections of the binder. Section 1 is where you can find our contact information. Our main clinic phone line is answered Monday to Friday between 8:30 a.m. and 4:30 p.m., except over our lunch hour, which is between 12 and 1 p.m. When you call the main clinic number, listen to the automated greeting and follow the directions. You will reach a cancer care clerk who will ask you about the reason for your call. That information is sent to a nurse who will call you back. It is important to know that phone calls are returned based on urgency. For example, phone calls related to symptoms will get a call back the same day or within 24 hours. Try to call early in the day if possible. If it is okay to leave you a message, please let the clinic know. If your voicemail or answering machine greeting states your name, we can leave you a more detailed message. This ensures that the information we are leaving gets to the right person. It is also important to know that we are unable to accommodate walk-in patients. If you have a question or concern that needs a face-to-face visit with your oncologist, you must book an appointment. You should call the oncology clinic if your concerns just can't wait until your next scheduled visit. For example, call if you're having symptoms related to your treatment or your cancer. Test results will be discussed with you at your next scheduled appointment. It is important to know that test results cannot be requested over the phone. If there is a test result that is important for us to share with you before your next visit, you will be called by the clinic. Also, call us at the clinic if you would like to change your appointment time or if you would like to make an appointment with a member of our supportive care team. This includes our social workers, spiritual care support, and psychotherapists. If you have symptoms that occur when our clinic is closed, you can always refer to the patient education binder for tips on managing your symptoms. If you have tried those suggestions but feel you still need more help, you can call the after-hours phone number. This phone service gives you access to oncology certified nurses who can help you manage your symptoms over the phone or direct you to seek medical attention if needed. While these nurses are not Walker Family Cancer Center nurses, they are certified cancer care nurses who provide telephone symptom management support to cancer patients across the region. They do not have access to your medical records, and therefore they will rely on you to provide information about your diagnosis and treatment so that they can assist you. We have developed a patient information sheet that contains some of your personal medical information and will help you when talking to these nurses on the phone. Please be patient when answering their questions, as they will need this important information in order to provide the best care possible. In addition to the patient information sheet, you should have an up-to-date medication list handy. You can get this at the pharmacy where you get your prescriptions filled. Now, Section 2 of the binder has information about patient safety and talking to your doctor and team. Section 3 of the binder reviews who some of the team members are at the Walker Family Cancer Center. These sections are covered in more detail during our orientation presentation. If you have not already viewed this, it can be accessed from the Niagara Health website on the Cancer Care Oncology page in the section for new patients. Section 4 of the binder contains information about cancer and cancer treatments. Many people are looking for places to find information about cancer. Your cancer care team, including your oncologist and nurses, are great resources. Write down your questions and bring them to your appointment so that they can be answered at that time. The patient education binder also contains a lot of helpful information that we have put together for our patients and families. The internet also has a lot of information for you to access. It is important that you use caution when reading information on the internet. Not all sources are trustworthy. We have included some reliable internet sites in your binder. If you have questions about things you may have read online, bring them to your clinic appointment so that your team can help you understand how that information applies to you. The Walker Family Cancer Center has a patient and family resource library where you can find printed materials for you to take home and keep. There is information on the different types of cancer, diet and nutrition, available support services in the community, and pain and symptom management. During a time when physical distancing is encouraged, this room may be closed, but you can still get access to the resources by asking your cancer care team. Cancer is a disease that starts in our cells. Normally, our body has cells that grow in a very orderly way. Cancer cells, however, do not act like normal, healthy cells. Cancer cells do not have the off switch that normal, healthy cells do, and as a result, they grow out of control, developing into tumors or cells that are not working the way they should. There are many different types of cancer, and within the different types of cancer are different stages and different grades. The important message to know is that cancers are treated differently, and so not all information applies to everyone in the exact same way. While some people may gain comfort in hearing other people's stories and experiences while going through treatment, you cannot expect to have the exact same treatment plan or feel the exact same way they did, even if you do share a similar diagnosis. Cancer is treated in a number of different ways. Systemic therapy, which includes chemotherapy, surgery, radiation therapy, and surveillance. When any two or more of these treatments are used together to treat cancer, it is called multimodal therapy. You and your doctor will work together to decide what the best treatment plan is for you. Chemotherapy is a way of treating cancer by giving medications to attack cancer cells. These medications can be given in your vein, by mouth, or by injection. Treatment goals can be different since cancers are different and people are different. Cure is working to destroy all cancer cells, while control works to shrink tumors and attack cancer cells to increase survival by keeping the cancer from growing anymore or spreading any further. Palliative treatments destroy as many cancer cells as possible to reduce symptoms and improve quality of life. Your oncologist will discuss your treatment goals with you. Section 5 of the binder provides information on lessening symptoms and side effects. A symptom management package should have been provided to you by your nurse and inserted into this section. The front sheet of this package has the title Fever. Cancer cells are not the only cells in our body that divide rapidly. We have many other healthy, rapidly dividing cells found in our blood, digestive system, mouth, hair and skin, and reproductive system. Some of these healthy cells can be affected by chemotherapy, and the result is side effects. Each person's experience with side effects can be different. Even two people receiving the same chemotherapy will not necessarily have the same side effects occurring at the same time or to the same degree. We can provide you with information on what side effects may occur when you're on treatment, but we cannot predict exactly how you will feel. Side effects can start at any time during treatment. Eventually, after your treatment has ended and those healthy cells have a chance to grow again, your side effects will slowly start to improve. There are 3 different kinds of cells within your blood that can be affected by your treatment. These include your white blood cells, red blood cells, and your platelets. Each of these different types of blood cells has a different job within your body. Let's talk first about white blood cells. These are part of your immune system. When your white blood cells become low after treatment, you are at a higher risk of getting an infection. Fever is one of the first signs that lets us know you might have an infection. You should have a working thermometer at home. A simple digital thermometer can be purchased from the drugstore, similar to the one in the photo here. You should take your temperature if you are feeling unwell in any way, if you're feeling warmer than normal, or if your oncologist or nurse have asked you to do so. We consider a fever to be a temperature of 38.3 Celsius or 100.9 Fahrenheit or higher at any time, or a temperature of 38 Celsius or 100.4 Fahrenheit for longer than 1 hour. If you have a fever, you should call right away. Call the clinic when we're open and call the after hours number when we're not. Only take Tylenol, also known as acetaminophen, for a fever if your oncologist has told you it is okay. Remember, a fever is a sign. It lets us know that there may be something more serious like an infection. So please pick up the phone and call us as soon as you know you have a fever and let us tell you what the next steps are. If you use Tylenol to help with pain and you are taking it regularly, for example, every 4 to 6 hours of each day, please speak with your oncologist. They may need to prescribe another pain medication that will not mask a fever. If you ever need to take the occasional Tylenol for pain, just check your temperature first to ensure that you do not have a fever. Red blood cells are used to move oxygen throughout your body. If your red blood cells become low following treatment, you may feel tired, weak, dizzy, or lightheaded. You could experience headaches, shortness of breath, pounding in your ears, or you may look more pale than normal. If you have any of these symptoms, please call us so we can help. Platelets are used to stop bleeding. If your platelet count becomes low after treatment, you may notice unusual bruising, bleeding more or longer than normal, or your poop may appear black and tarry. If you experience these symptoms, please call so we can help. However, if you have bleeding that you cannot get to stop, for example, if you get a nosebleed that continues even after 10 minutes of applying pressure, please go to the nearest emergency department to seek medical attention. Hair loss is another possible side effect of treatment. It does not happen with all chemotherapies, but it can happen with many of them. It is important to know that this side effect is temporary, and eventually, after your treatment has ended and those hair follicles have a chance to grow again, you will slowly start to get your hair back. In the meantime, there are some excellent community supports available to help you get through a time that you might not be feeling your best. Wellspring Niagara is one of our community partners, offering a wide variety of programs and services to meet the social, emotional, restorative, and informational needs of people living with cancer. All programs are free of charge for anyone living with cancer at any stage, as well as for their caregivers and family members. We encourage you to check out their program calendar to see what they have to offer. Look Good, Feel Better is a workshop offered through Wellspring Niagara to help women with cancer feel like themselves again. It focuses on skincare and cosmetics, wigs, and hair alternatives. For men, there is a support group called the Men's Room for patients and or their caregivers who are experiencing a more recent journey with cancer. The program provides men with the opportunity to meet with other men and obtain tools that will help them overcome negative thoughts and help them move forward through their cancer journey. Please note that due to COVID-19 safety precautions, Wellspring Niagara's site is temporarily closed, but many programs can still be accessed virtually. Please check their website for details. It is important to practice good mouth care when you are on chemotherapy. Use an alcohol-free mouthwash or the simple mouth rinse recipe that we have provided in the binder, which is made up of water, baking soda, and salt. You should try to rinse your mouth in the morning, after each meal, and before bed at night to keep your mouth clean and moist. You can continue to use a soft bristle toothbrush to clean your teeth, and be gentle when brushing to avoid bleeding. Sometimes rinsing and brushing alone are not enough, and you could end up with painful mouth sores, making it difficult to eat or swallow. Please call the clinic if you have these symptoms. A medicated rinse can be prescribed by your oncologist. If you have nausea and or vomiting, we suggest that you eat and drink small amounts throughout the day. Sometimes big heavy meals can make you feel more sick to your stomach. You will be prescribed medications to help prevent and control nausea. If you have taken these medications as directed and followed all the tips in the binder, but you still are having any nausea or vomiting, please call us. There are other medications and strategies available to help you better manage this symptom. If you have a loss of appetite, we recommend that you eat foods you enjoy. Likely, when you don't have an appetite, you're not eating very much, so we need to ensure that every bite you take counts and has enough calories in it to provide you with the energy and nutrition you need. Some examples of foods packed with calories are smoothies and blended soups. Eating with other people sometimes provides a nice distraction, and you may eat more when you're eating in company. If the tips provided in the binder are not enough to help you with eating, ask your clinic team about a referral to our registered dietitian. The Walker Family Cancer Center has a dietitian who is part of the supportive care team and focuses on nutritional counseling and support for patients with cancer. If you're having constipation, it is important that you aim to drink 1.5 to 2 liters or 8 cups of fluid each day. Taking a short walk will help you to get your bowels moving. You can take stool softeners and laxatives as directed by your oncologist or nurse. If you have not had a bowel movement or poop in 3 days, please call the clinic so we can help you. If you're experiencing diarrhea, it is still important to drink plenty of fluids to replace any losses that you may have from loose, watery bowel movements. Try to avoid high-fiber foods, spicy foods, and caffeine when you have diarrhea, as these things may make it worse. If you're having diarrhea and are taking laxatives as part of your daily medication routine, please stop the laxatives at that time. If you've followed all the advice in the binder for managing diarrhea, but you continue to have loose stools at 2 or more times your normal amount, please call the clinic so we can help you. There are other strategies and medications that we can provide to help you better manage this symptom. Fatigue is the most common side effect related to a cancer diagnosis and treatment. It is important that you listen to your body and save your energy for those big, important things you want to get done. If you have family or friends around, learn to ask them for help so they can support you during this time. Including mild to moderate forms of exercise in your daily routine will give you more energy and help you to feel better overall. Cancer Care Ontario has made a booklet called How to Manage Your Fatigue. It has lots of tips on managing cancer-related fatigue, which is a different type of fatigue than what most people know, and therefore is managed in a different way. If you're interested in this resource, speak to your clinic nurse. If you're going to be out in the sun, it is important to protect yourself by using a sunscreen of 30 SPF or higher. Keep your skin moisturized and wear protective clothing like a shirt with sleeves, a hat, and sunglasses. These safety measures should be practiced even in the cooler months when you're going to be out in the sun. It's important to keep your skin moisturized by using an alcohol-free, fragrance-free, dye-free cream or lotion. Those ingredients can dry your skin out. Moisturizers containing lanolin will provide more moisture. Sexuality can be a difficult topic to discuss with your doctor or nurse. It is important to remember that we are all human, and it is natural to want to feel close to your partner or to have questions about how to do this safely now that you're starting chemotherapy. If you're not completely comfortable having this discussion with your cancer care team, you can ask for printed materials on intimacy and sex or access reliable internet sites. Fertility can be temporarily or permanently affected by chemotherapy in both men and women. It is important that pregnancy is avoided during the entire duration of treatment due to the unknown effects cancer treatment can have on a developing fetus. If you need records from your hospital chart, you can access them for free through an online patient portal called MyChart. Register online at healthrecordsonline.ca/register to get access to your health records from hospitals in Southwest Ontario. You were provided with information on how to register for MyChart. If you have any additional questions, ask your clinic team. Your medical records at Niagara Health can also be obtained from the Health Information Management Department, which is in the main part of the hospital. There may be a fee for obtaining certain records. They can be reached by calling the main hospital number and asking to be connected to Health Information Management. These instructions are also available in the binder. If you are ever in an emergency situation and are outside of the hospital, you should call 911. When the first responders arrive, be sure to tell them you are receiving chemotherapy, when you had your last dose of chemotherapy, and if you are receiving chemotherapy at home. This will alert them to properly protect themselves in case they are exposed to your bodily fluids. We will talk in more detail about these safety precautions later on in the presentation. If you need to go to the emergency department, be sure to bring your medications and your patient education binder. There is some information in the binder that would be helpful to the emergency department staff. When you arrive at the emergency department, you will register as all patients do, and be sure to let them know you are an oncology patient on chemotherapy. This information does not move you to the front of the line, but it will definitely help to determine where in the lineup you will fit. If you're in the waiting area and you start to feel more unwell while you're waiting, it is important that you or the person you're with get up and inform the emergency department staff. They may have to bring you in sooner than they had planned when they did their first assessment. If you're going to the emergency department with a fever, be sure to present your fever card. The front side of the card is the patient side with information about fevers and important contact phone numbers. The back side of the card is like an alert for the emergency department staff. It lets them know you are on chemotherapy with a fever and the necessary steps they need to take to safely care for you. If you have not received a fever card, ask your nurse for one. The doctor in the emergency department will be the doctor responsible for your care when you are there. They will only consult with your oncologist if they have specific questions about your cancer or cancer treatment. The emergency departments will have access to some of your electronic oncology records. There are some changes that will need to be made at home when you're on chemotherapy in order to keep you and those who are close to you safe and comfortable. We understand that being with your loved ones is an important part of life, and we want to ensure that you continue this while you're on treatment. It is important to know that we get rid of chemotherapy through our bodily fluids, including urine, stool, vomit, semen, and vaginal fluid for up to 7 days after the last dose of chemotherapy. The risk of exposure is really quite low, but it is important to use safety measures in order to further lower that risk. If you have linens or clothing that have come into contact with bodily fluids during that 7-day period following chemotherapy, you should handle them wearing disposable gloves. These can be purchased from the drugstore to have on hand at home. Wash the soiled items right away in hot, soapy water, separate from your other laundry, and run the wash cycle 2 times. Again, it is only for those items that have come into contact with bodily fluids during the 7 days after chemotherapy. All other linens and clothing can be washed as normal. Men who are on chemotherapy or who have a partner on chemotherapy need to use a condom during sexual intercourse for the 7 days after chemotherapy. This will protect themselves or their partner from bodily fluids. When using the toilet at home, flush the toilet with the lid down to block any spray. If you have a low volume toilet, flush twice to ensure that everything has been flushed down. If you are going home on a chemotherapy infusion, you will get specific instructions as well as any necessary supplies and equipment from the oncology team or the home and community care service providers, so you can safely manage your chemotherapy infusion at home. Section 6 of the binder talks about ways to stay as healthy as possible while on treatment. Staying healthy includes physical care like exercise, good nutrition, oral care, as well as looking after your body, mind, and spirit. We have already mentioned that low to moderate forms of physical activity can reduce fatigue and also improve the way you feel overall. Exercise is known to help with many symptoms of cancer and cancer treatment. Exercise really is any activity that gets you moving, so pick something that you enjoy. If you're not too sure about how to get started, ask your clinic nurse for the exercise guide for people with cancer. It provides tips to help you safely start an exercise routine. Many people have questions about what to eat and drink now that they have a cancer diagnosis. The Canadian Cancer Society has published a booklet called Eating Well When You Have Cancer, with lots of great tips and recipe ideas. This can be found in our Patient and Family Resource Library and on the Canadian Cancer Society website. It is advised that you do not drink alcohol during the entire time that you're on chemotherapy treatment. If you have any more specific questions about chemotherapy and alcohol, ask your cancer team. It is important to know that you will not be able to go to the dentist to have your teeth cleaned or any dental work done while you're on chemotherapy due to the risk of infection and bleeding. You will have to wait 4 to 6 weeks after your final treatment before you can go back to the dentist. This is why good oral hygiene is important to keep your teeth and gums healthy. If a dental emergency arises while you are still on chemo, please speak to your cancer care team. Section 7 of the binder talks about how to prepare yourself for treatment days. On your treatment days, bring the medications that you need to take on that day, such as the anti-nausea medications prescribed by your oncologist, or if you require diabetic, pain, or other medications during the day, bring those as well. Bring your patient education binder along with any questions you have. The Systemic Therapy Reception Desk has asked that you check in no earlier than 10 minutes prior to your scheduled treatment. This will allow for physical distancing and keep the waiting area from getting overcrowded. Bring something to eat, a snack or lunch if you will be here over the lunch hour. We ask that you please do not bring any cashews or mangoes into the Cancer Center. There is a staff member with a severe allergy to these food items, so please keep them at home. Bring headphones for the TV that is available at most treatment chairs. Books, tablets, devices, crosswords, anything really to help you pass the time. And we do recommend that you dress in layers. The treatment room temperature can change while you're there. Family and friends are important and comforting to have at your appointments. However, under certain circumstances, like the pandemic, visitor policies may be restricted and will be explained to you. Ask your clinic team if you have questions. The Systemic Therapy Suite is a quiet zone, so please silence your phone, refrain from using speakerphone when making voice calls in the room. Texting is welcome, and please use earphones if you need to hear anything from your device. After your first cycle of chemotherapy, it is expected that your blood work is done on a day before your next scheduled treatment. Your clinic nurse will provide you with instructions on when to go for blood work. You will receive a requisition to take to your community lab, such as Life Labs, to have this done. If you require blood work on a Saturday, please check in advance to see which labs are open on Saturday and what their hours are. Not all labs offer service on Saturdays. If a holiday interferes with your treatment or blood work day, please get specific instructions from your clinic nurse. To help us understand how you're feeling and what issues are most important to you, please complete the Your Symptoms Matter assessment. This can be done at home before you come to see the doctor in clinic. The website address is listed at the top of your appointment slip. You will need to have your health card ready. If you're not able to access the online symptom assessment from home, let the clinic team know when you arrive so that they can assist you in completing it. Sometimes treatments can be delayed. The most common reason is because your blood counts are low. It is important to know that this is not your fault. As we discussed earlier, a drop in your blood counts following chemotherapy is expected. Your body just may need more time to recover. If your blood counts are low before your next treatment, one of two things can happen. Your team may repeat your blood work when you arrive to check if your blood counts have come up to safely proceed with the next cycle of chemotherapy. Or your oncologist may delay your treatment by a week and check your blood work again at that time. Before you leave the clinic, make sure you have your next scheduled appointment, any requisitions for tests that are being ordered, and prescriptions for medications that your oncologist is prescribing. Always carry an up-to-date medication list and let us know about any changes to your medications so we can update your record. We need to ensure that none of the medications we are prescribing or administering will interfere with any of your other regular medications. If you require a refill for medications and it is in between your clinic appointments, please contact your pharmacy. They can work with us to get the refill for you. Contact your pharmacy when you notice that you're starting to run low on your medications. It could take a couple of days to coordinate a refill, and we don't want you to be completely out of your medications. This slide gives an overview of the cancer care journey. Notice the gray bar along the top that reads primary care. This represents your family doctor, who should be involved every step of the way. While your oncologist is a specialist in your cancer care and treatment, you should still keep a close relationship with your family doctor to help manage any of your other medical needs. For symptoms that are not due to your cancer or cancer treatment, please call your family doctor. If you're in need of a family doctor, here are some resources available to you to help connect you to physicians who are currently accepting patients in your area. Niagara Health has an information line with a recorded message listing doctors within the Niagara region who are accepting new patients. Or you can register for the Healthcare Connect program by calling 1-800-445-1822. This information is also available in your binder. Hauser's Pharmacy is a community pharmacy that happens to be located in our St. Catharines Site Hospital. They are on the main level of the hospital, across from the cafeteria. Hauser's offers many services and products that have been helpful to the patients of our cancer center, including lymphedema services, mastectomy products, and ostomy supplies. If you will need a PICC line as part of your treatment plan, Hauser sells a shower sleeve that you can wear to keep your PICC line from getting wet. If you have a good relationship with your current pharmacy, you can continue to get your prescriptions filled there. Sometimes community pharmacies do not stock the hard-to-find oncology medications that our doctors prescribe. If you find yourself in that situation, check Hauser's. They tend to keep those medications in stock simply because they work closely with our cancer center. Okay, now let's take a quiz to see what you remember. Question 1. All laundry for patients receiving chemo needs to be washed separately twice in hot water. True or false? The correct answer is false. Only laundry that has come into contact with bodily fluids during the 7-day period following your last dose of chemotherapy needs to be washed separately twice in hot water. Question 2. Is it okay to hug or kiss a person who is getting chemotherapy? The answer is yes, absolutely. We encourage it. However, in a time when physical distancing is encouraged, it is advised that you avoid direct contact such as hugging and kissing, particularly with those who do not live in your household. And always protect yourself by staying away from people who might be sick. Good hand washing practices are strongly encouraged always. Question 3. When should I call the clinic? Select all correct answers. A, if you have a fever. B, if you need to cancel your appointment. C, if you need to speak with a social worker. D, if you're requesting test results. Or E, if you get a bee sting. The correct answers are to call when you're experiencing symptoms, when you need to cancel an appointment, or if you would like to get connected with one of our supportive care team members. Question 4. What is a fever? A temperature of 38.3 Celsius or 100.9 Fahrenheit or higher at any time, or if you have a temperature above 38.0 Celsius or 100.4 Fahrenheit for an hour or longer. Question 5. What should you do if you have a fever? You should call the clinic immediately, or call the after hours number when we're closed. Do not take Tylenol for a fever unless your oncologist has told you it's okay to do so. Of course, follow specific instructions from your oncologist. And if you ever have a fever and you're feeling unwell, please go directly to the emergency department. Thank you. That concludes our presentation. If you have additional questions, please write them down and bring them to your next appointment with us at the Walker Family Cancer Center.